In 2019, the Ministry of Health and Wellness, under this new name, made significant interventions towards improving the availability and access to quality healthcare services for the well-being of the population.
But we do more than that. We have allocated resources to support the upgrade, to catch up with the gaps that existed in our healthcare infrastructure. And this is not a promise, it is a commitment.
Early in the year, the Infection Prevention and Control Unit at the University Hospital of the West Indies was outfitted with ICT infrastructure at a cost of $31.7 million.
This new system will help the university to be more effective in its combat against a number of infections and diseases, and certainly within a very timely manner, with the use of credible data at your fingertips to inform the decision-making and response processes.
The ministry also continued to integrate digital technology into the public health record system, and telemedicine services expanded in 3 health regions. Another major milestone was reached when the ban on certain types of sugary drinks in schools and public health institutions took effect in January. A $50 million health research fund was launched. In March, a $78 million mammography unit was officially opened at the University Hospital of the West Indies, boasting advanced 3D imaging machine for detecting breast cancer.
And therefore provides a much more accurate prescription. That's a three-dimensional approach.
A major achievement came as government began offering Jamaicans suffering from lupus access to medication at subsidized costs through the National Health Fund (NHF). The Health Ministry also tabled a 10-year strategic plan, a green paper on the proposal for national health insurance, and a major capital expenditure plan for the next 5 years. A memorandum of understanding between Jamaica and India set the stage for improved partnership to exchange and train medical professionals and set up healthcare facilities and initiatives for the prevention and control of NCDs. The Black River Health Center was reopened in May after a $13 million renovation and expansion project. A $29 million contract was signed and groundbroken for the construction of the Caenwood Health Center at Point Hill, St. Catherine. An eye clinic and training center was opened in Magotty, St. Elizabeth with the assistance of the Diocese of Poland and Food for the Poor. Under the ministry's Adopt a Clinic program, Massey Distribution Jamaica Limited committed $3 million towards upgrading the Seaview Gardens Health Center over 3 years. Similar agreements were reached for the Olympic Gardens and comprehensive health centers. Other developments included the renovation and expansion of the Black River Health Center, as well as the Stony Hill Health Center. Work progressed on the establishment of Centers of Excellence for Oncology and Nephrology at the St. Joseph's Hospital and the Cornwall Regional Hospital, as well as at the UHWI. Jamaica's first cardiology interventional suite was opened at the University Hospital of the West Indies in May.
It's a special occasion. It's an amazing achievement.
$3 billion is allocated for infrastructure development at 7 hospitals and 3 health centers. A capital expenditure plan of $27.2 to $31.2 billion was also unveiled for the next 5 years.
The largest investment in over 20 years in public health, and we are proud of it.
A further $6.2 billion in financing was secured under an IDB agreement to take care of critical infrastructure needs and the implementation of a health information system. And the construction of the Western Children and Adolescents Hospital got underway.
It is a 7th-floor hospital, 60 rooms for residence facilities, so staff, professionals who work in the institution will also have accommodation in the building. The building will boast outpatient emergency, surgical, lab, and intensive care services.
The existing Children's Hospital, meanwhile, benefited from a new state-of-the-art pediatric cardiac center in April. And later, a contract was signed and groundbroken for the construction of a new drugstore pharmacy also at Bustamante Hospital for Children. Phased restoration and upgrading work on the Cornwall Regional Hospital progressed, with work on the roof of the 10th floor under the first phase completed, and Phase 2, which includes the demolition of interior walls and further strengthening of the hospital roof, advancing.
We're doing a major overhaul, and so when we would have been completed, we will have a hospital in Western Jamaica that will give top-notch service, both from the personnel who are here, but also in terms of the building and the equipment to give support.
Arnold Regional Hospital's new $50 million radiology department was officially opened in June, with state-of-the-art X-rays, computerized tomography, CT scans, and ultrasound devices. Also in June, the Southern Regional Health Authority added 3 newly retrofitted ambulances, costing just under $31 million, increasing its fleet to 14. The Accident and Emergency Department at the Princess Margaret Hospital was reopened after extensive rehabilitation and expansion. New elevators were also installed at the Victoria Jubilee and Spanish Town hospitals. While launching a 24-hour mental health and suicide prevention helpline, the ministry bought 14 new buses to assist with community mental health service delivery and response. 200 transport or trauma stretchers and reclining chairs were procured for distribution to hospital A&E and areas where there are bed shortages. The Cornwall Regional Hospital was provided $20 million worth of surgical equipment and supplies. Meanwhile, a $9.4 million state-of-the-art ultrasound machine was installed at the Spanish Town Hospital. And Maypen Hospital's orthopedic surgical department was officially presented with a brand new C-arm X-ray machine to improve diagnostic services and patient treatment. The health sector also received a number of other donations last year. The $1 billion initiative to reduce waiting times in public hospital gained more traction last year. And in September, the ministry began contracting private labs to provide free diagnostic services for approximately 60,000 patients where the service was not available in the public sector. Meanwhile, a medical center was opened and a 10-year memorandum of understanding signed with the AIDS Healthcare Foundation to offer expanded services at 3 regional health authorities.
HIV patients should be treated no differently from persons with diabetes or hypertension or any other such disease.
In March, the National Family Planning Board launched the Positive Health, Dignity and Prevention Framework and Annual Implementation Plan, which supports the ministry's Test, Treat and Stay initiative. A memorandum of understanding was also signed to make provision for persons living with HIV and AIDS and to activate the Fast Track Cities program in Kingston. In addition to $581 million in budgeted expenditure, $1 billion was approved for enhanced vector control interventions as the country dealt with a dengue fever outbreak. A second national insectary was also opened, strengthening the government's ability to reduce the spread of vector-borne diseases. As reflected in its new name, in 2019, the Ministry of Health and Wellness launched a 6-point wellness agenda for Jamaica, encouraging healthy eating habits, physical activity, and periodic health checks. The ministry also launched a physical activity guide in Braille in partnership with the Combined Disabilities Association. The compassionate care feature of the wellness agenda was expanded when the Noel Holmes Hospital began offering this as part of its services. Several pieces of legislation were also given priority attention in the past year, including the Framework Convention on Tobacco Control Implementation Bill, the Opticians Act, the Food and Drugs Amendment Act, and the Public Health Funeral Establishments and Mortuaries Regulations. These were some of the major activities of the Ministry of Health and Wellness in 2019 on a mission to realizing the vision for healthcare development.